Welcome back to SouFLoTV again, everybody. It is your host with the most. Just go ahead and hit that subscribe button, please. Hit the bell next to the subscribe button so you're notified every time a new video goes up on SouFLoTV. This one is from The Gleaner and it's called Not My Responsibility. Listen to this though. This is about, right, a man who abandoned his children and now he is in need of help. And the state is threatening to sue those closest to him, which could work out being the same children that he abandoned earlier on in his life. So you're a deadbeat daddy out there in problems and the state is about to sue you and saying you need to come get him and take care of him. We're going to talk about that part of the story, but there's another part of this story as well that I need you to hear. So the story went like this. A threat by the government to take legal action against families who have abandoned their relatives at the island's public hospitals have not scared Candice, is her name, who is convinced that her father, Carlton, is right where he should be, which is out of her life. Health and Wellness Minister Dr. Christopher Tufton had signaled the state's intention to pursue civil action against these families as the sector was crumbling under the weight of the third wave of the COVID-19 pandemic. Facilities are full and overcrowded, and there are a lot of people inside of these public hospitals who relatives just brought them there, dropped them off, and never ever returned to pick them up. So you can imagine just living in a hospital with nowhere to go. Now, more than 500 persons who have been discharged still remain in the island's major public health facilities, more than 500. This is the longest current case being 14 years. Imagine sitting in a hospital for 14 years, occupying bed space and putting a strain on resources as their relatives have not returned to pick them up and take them home. Referred to as social patients. It costs the government roughly $408.6 million annually, $408.6 million annually to take care of these 500 persons at an average of $2.04 million per person. This expenditure includes remuneration for nurses, doctors, social workers, and nursing assistants who tend to them occasionally, as well as medication, accommodation, meals, toiletries, and other personal care items. I would say that we need a facility where the weakest of our population are still able to be cared for in some dignified manner. But that would be in a perfect world. That would be like saying there should be no killing and nobody actually kills for real. I can't even compare this to the US because in the United States of America, I have seen them wheel people out of the facility onto the sidewalk in a wheelchair and said, bye, go figure this out. But we can't keep you here beyond a certain time. So 14 years in a public hospital just because your family won't come pick you up or you have nowhere to go, that's garbage. That's slackness, right? So the figure could be significantly higher if cost accumulated by Bellevue, which is Bellevue is a mental health institution in Kingston, and Bellevue has more than 350 social patients. Social patients, again, are people who rely on the system because they have no one to come pick them up. So they're just living there in this public facility. And Bellevue has over 350 of those. Are added using the same base costs. Although yesterday the health ministry could not readily say whether the average cost would be similar to that at other facilities. Tufton, however, noted that it was expensive But despite pleas by health officials, including hospital administrators, for Jamaicans to collect their relatives, Carlton is no closer to knowing his fate, even as another Christmas day passes by. Candice, who is Carlton's daughter, Candice is an educator, a teacher in the early childhood sector. And Candice told Sunday Gleaner that her dad had walked out of their lives when they were at a very tender age, causing the family great pain, and adding that the act was unforgivable. In other words, you abandoned us as children. Mommy stressed out under the stress. I tried to do this by herself. That was unforgivable, boss. And now you're a big man laid up in a hospital facility, and these people are looking for us to come talk about bring legal charges to us. You're good, right? Which part you're there? Out of my life. I find this kind of funny because this is something that I talk about on SouFLoTV all the time, don't we? My audience, tell the man them say, make sure you're there for your children and make sure that you sow good karma seeds, because the future might be rough on you, and it's them same children there that are either going to have to come help you by turning you and wipe your body and clean up your nappy or you change your diaper, get you off of the pissy bed, move you around in your wheelchair, or if you want them come kick where you're walking stick while you're walking and push you down a flight of steps, then do bad by them or abandon them now and make them have to grow up on their own and face the world alone with no protector provider while you're out there enjoying life and gallivanting with yourself. I've actually known people in real life, cases of people in real life who left their own children to go pick up a strange woman who had children already by somebody else. And they became great father to those stepchildren while their own children were abandoned. Now I know there's lots of dynamics to this. Mommy might have been a tegereg, and she probably was one of those vindictive females who felt like the kids were a bargaining chip when it comes to the relationship with the father. Many women do that, like they damage the relationship between the children and the father and hold the children hostage and do things on purpose to spite the father but spite the children instead, because only some men can take that pressure. Other men, they run away from it and them say, yo, you know what, when they pick them older, then I'll go find them and we'll talk about this as grown people. But me now make you mad me, my girl. I'm not letting you stress me out and mad me and send me go down a Bellevue. So me I go leave, me I cut. And they actually leave and leave their children's life. And no one explained this to the children. But may I tell the man them, say, fight through whatever you have to fight through and be there for your children, because you don't know how life is going to turn out. And trust me, if you put love and care into your children, it's very rarely that a good child abandons good parents. See? Now I say it not happening, because the world full of all kind of people. But very rarely does good children who were raised properly with love and all your attention and stuff abandon you in your older days. Now, she said, my only recollection of my father being around was when I was about 6 years old. That's it. When my sister was a baby, he walked out on us then. And all I had was my mother, who did what she could to put food on the table for us. And there is no court that can tell me now that he is my responsibility. Before I go any further with this article, I want my audience to answer in the comment section below. Is he her responsibility now? I will give you my answer straight up. Hell to the no. He is not her responsibility, the same way how he neglected his responsibility to her and her sister and her mom as a father and left them to the mercy of the world when they were children, is the same way she's entitled to leave him right now and say, nope, he's not my responsibility. If he had raised her and he was a part of her life and then she just wheel him out of the house and go put him there, then I would say that was foul. but he wasn't there for them. He wasn't there for them. Do you know how much hurt develops inside of a child when a child realizes that my daddy not dead. My daddy over there, so I live him life. And I'm over here suffering. Mommy get frustrated, she take it out upon we because she's buckling under the pressure of having to do this all by herself, etc., etc. Children grow up with resentment. You understand? And even those who are able to forgive, they won't forget. And don't come running to them when they have made something of themselves and life has turned the tables on you. That's one of my biggest fear. One of my biggest fear is actually having any of my children grow up to say, my daddy, yo, the man there is a piece of SHI, you know what. Him never do nothing for we. Him abandon we, him left we. That's one of my biggest fear. So I put overtime in, and I encourage my brothers to do the same. Now, she said that such a decision would also disrupt my own family life because she said such a decision as Dr. Christopher Tufton and them coming after her and saying he is her responsibility. That would disrupt her own life because I have never mentioned him, not once, to my children or even my husband. She said, wow, he is fine right where he is what she said. That's sad. You have grandchildren, you don't even know them. Your daughter's husband, you don't even know him. They have never had a conversation concerning you. And you are here, right here on the island, laid up in a hospital all these years. He is fine right where he is, she said. Now, with Bellevue topping the list for social cases with 350 of the just over 500 patients, the problem plagued Cornwall Regional Hospital in St. James, where Carlton remains. Comes in next with some 55 social cases, followed by Black River, which has 18 people living there like that, social cases. Kingston Public has 16 of them living there. Savlamar Hospital has 15 of such cases living there. This is according to data that was obtained by the Sunday Gleaner since November 30th of 2021. Administrators nationwide are expecting the numbers to climb even higher during this holiday season, as traditionally, and I've seen a doctor out of Jamaica on Instagram begging the people of Jamaica, say, please don't do this, because you know the holiday come around and people want to be partying and be enjoying the festive season, go out and come in as they like and all these things. But if you have somebody that needs round the clock care inside of your house, it kind of puts a damper on your party vibes, your celebration vibes. So it is traditionally something that they actually do. More relatives around this time of the year actually seek to get rid of these types of family members, get rid of these responsibilities of caring for their elderly family members in order to party or to travel. Them just got left them at the hospital. When them come back, they'll pick them back up. And then there are those who never come back for them at all. What also do you think about that? Boy, this ain't us. This ain't supposed to be us. I come from a time in Jamaica where grandmother, mother, children, everybody in a one house. And when granny get too old, everybody takes turn rotating out around her. So she is always surrounded by somebody who she had some kind of touch in their life. You understand? That's like what we did with my grandmother. Not send her to a home or abandon her in a hospital. And some of them people here are wicked enough, because you see some of these old people, there's some of those people or some of these people who are ill and left in these facilities and need help. These people are people who have actually given so much to their life. And now just for you to give them some end of life care, you put partying and traveling and everything else before them. Park them in a hospital and leave them there. I'm sorry, but karma must find you, and it ain't gonna miss. And it's not gonna be what you think it is. Hospital hopping. This is something now that I'm learning about. Hospital hopping is what it's called. Hospital hopping has become a popular practice, officials say, where relatives will leave the family member at medical facilities one Christmas, but then they will take them to another location the following year. Why? Because they don't want the medical facility to say, every Christmas you show up around this time and drop this person off. So they hop from one hospital to the other doing this. Dr. Christopher Tufton told the Sunday Gleaner that the legal team is well advanced in its investigations into specific cases to be placed before the courts to determine if persons can be held accountable for their abandoned relatives under Section 10 of the Maintenance Act. The team is now gathering data on specific cases, and we intend to pursue them in the new year and see what the court rules on the matter. This will also determine if legislatively there needs to be changes to the law. A case-by-case investigation is being used to differentiate the infirm from those who have been abandoned in the case of the state, Tufton said, and to determine options in terms of classification. In other words, some people might need to be in that facility, right? They're infirmed. They need to be in that infirmary, in that kind of a setting where they can be afforded medical help around the clock. However, there are others there who don't need to be there because they don't need no medical help around the clock. They're just hanging out there because their families have abandoned them. Some of the factors for abandonment, apart from neglectful fathers, includes the inability of relatives to care for special conditions, such as individuals that are bedridden or people that require 24 hours care, persons who are oxygen dependent, stigmas that are associated with HIV and AIDS, mental health concerns, and financial challenges, a ministry audit has revealed. Now, in the case of those suffering from mental health issues, especially the ones who are prone to violence, I myself as a family member wouldn't want them on my yard. I'm sorry. Now tell me in the comment section again if you think I'm wrong. I would not want them in my yard if they have mental issues and is a person where will draw a machete and try chop up everybody in the house when him head take him. Me don't want him on my yard. He needs to be institutionalized. Am I wrong or right? The Jamaica Constabulary Forces also fingered in the audit, which noted that cops use the hospital as a place of safety for persons who are in need of care and protection without providing information or assistance with investigations. You heard that? The Jamaica Constabulary Forces also fingered in the audit, which noted that the cops use the hospitals as place of safety for persons who are in need of care and protection without providing information or providing assistance with the investigation. Camille Lewin, I don't think that should fall under JCF though, the Jamaica Constabulary Force. They're doing their job. They're supposed to pick these people up and drop them off at a medical facility if so is required. So I don't see where the JCF should be held accountable for that, other than the fact that they could do a better job of the investigation part and provide better information to the facility to help them with their investigations, right? Camille Lewin, the CEO of the SouFLoTV Hospital, says that among her 15 social cases at the Type C facility are patients who were discharged from as far back as September of 2005. People, at 2021 we in there, you know? And she's talking about people who were discharged in 2005 and are still at the facility, taking up bed, taking up resources that can better be used for someone who actually really needs help right now. Since 2005. But while she is desperate to free up the bed space to accommodate the 45 waiting patients in her accident and emergency area, she cannot turn her back on patients facing abuse from loved ones. We have sent home patients, but they return soon after because they are being abused by their relatives. So we try to determine the conditions that they will be living in, because if they are going home to ill treatment, it is best to have them here. So that places me between a rock and a hard place. God bless our soul. This is what she told the Gleaner. One of my wards can accommodate 36 patients, and if I have 45 patients waiting on beds, I need those spaces, she added. But this number is going to go up because the trend is that during the Christmas season, relatives just drop off them senior family members with their luggage and drive away. Granny, talk about a burden on the system. More than 10% of bed capacity. Her colleague at the 50-bed Noel Holmes Hospital in Lucy, Hanover, Corrington McLennan, is desperate to have access to the 8 beds now occupied by social patients and is hoping for a solution sooner rather than later. All 8 patients have been here in excess of 5 years. And when you take into consideration that our bed complement is 50, if you do the maths, you will see that social cases take up more than 10% of our bed capacity, and this needs to be addressed, said McLennan. In 2019, the government implemented the Enhancing Healthcare Service Delivery Project with the objective of improving access to services in the healthcare system, a strategy to reduce wait time and overcrowding in hospitals. The removal of social cases from hospitals is among the areas targeted to improve service delivery, using several strategies including the filing of civil suits, partnering with the Ministry of Local Government and Community Development to expand facilities at the Kingston and Maypen infirmaries at a cost of $50 million, arranging for accommodation at nursing homes for some such accommodations to be found by the persons, the pensions of the affected social patient, and targeting families that are using the resources of the abandoned relative with a view to channeling those funds into their care and protection. So grandma, daddy, a collect her like a pension, and you got park her at one of these facilities, and you continue to collect and spend her pension while you pawn her off on the government. Wow. Listen now, I don't want to read no more of this article, and trust me, the article is long and has a whole lot of information in there. I will end it by saying this: the truth of the matter is that if you are living at the expense of the state, I don't think that there are a lot of options that they can exercise if there is an alternative arrangement that suits the greater good of society. And this is what one government official said. With that said, in closing, I want you to leave your comments in the comment section below. Tell me what you think about this one, and we'll keep the conversation going. Big up on yourself and take care of your elders. Don't go drop them off at no hospital and drive well left them with their luggage, because it's party time and time for you to enjoy Christmas and bring in the New Year's. I'm just saying. Hit that subscribe button. It's SouFLoTV. I'm out. Peace.